Today, I will be dealing with stroke. Then, what is stroke? What are the types of stroke, and what is stroke management? I've actually done a video on this some time ago, but then that video was not that comprehensive. I didn't talk about the management in details in that particular video. So in this one video, we'll be looking at stroke to understand what stroke is in its simplicity, then what are the types of stroke we have, and what is stroke management. So what is stroke? Stroke is basically a sudden interruption of blood supply to the brain, leading to weakness or paralysis of a side of the body. A sudden interruption of blood supply to the brain, leading to weakness or paralysis of a side of the body. Then there are things that can cause this sudden interruption of blood supply to the brain. This leads me to two major classes of stroke, or two major types of stroke. Number one, ischemic stroke. Number two is hemorrhagic stroke. Ischemic stroke is as a result of blockage of blood supply to the brain, either due to a thrombus or an embolus. A thrombus is a static clot, that blocks the blood supply to the brain along the arterial blood vessel, whereas a thrombus is a dislodged clot that travels to another site to further block blood supply to the brain. So when there's a blockage of blood supply to the brain, leading to weakness or paralysis of the body, it is called ischemic stroke. Ischemia is a medical term that generally means loss of blood supply. So when there is a blockage of blood supply to the brain, then ischemic stroke has taken place. So as I explained, it can be due to either the interruption of blood supply to the brain, either caused by a static clot known as thrombus, or a dislodged clot that travels to another site known as embolus. So when that happens, it becomes ischemic stroke. Then hemorrhagic stroke is basically rupture of blood supply, rupture of blood supplies, the rupture of blood vessel in the brain. When the pressure of the blood is high, it can lead to the rupture of tiny blood vessels in the brain, then making the blood to seep into the surroundings of the brain. That is the pia and arachnoid, the subarachnoid membrane. Blood seeps into the meninges, causing irritation, and of course, leading to stroke. There is another form of stroke which is of ischemic origin that is called transient ischemic attack, TIA. That type of stroke resolves within 24 hours. Some call it temporary stroke, some call it warning sign of stroke, but then it does not go on to lead to complete weakness or paralysis. So it resolves within 24 hours. That is why it's called transient ischemic attack. So it is transient. It is not permanent. It is temporal. Okay, so basically we have ischemic and hemorrhagic stroke. Then TIA, which is transient ischemic attack, which is another form of stroke, is of ischemic origin. So that one is just temporary. Okay, then having stated this, what is stroke management? Stroke management actually is all about how the condition is managed. When stroke happens, normally it's usually as a result of either increase in blood pressure or other medical conditions. Some time ago we talked about risk factors or predisposing factors. There are certain things that can lead to stroke. Let's assume that the stroke is caused by hypertension, sudden increase in blood or increase in blood pressure. At that particular point, the vital sign, which is the blood pressure, is usually very high. So during the acute stage of stroke, the blood pressure or other vital organ or other vital signs are usually not stable. So what happens at that time is medical management in order to stabilize those vital signs If the blood pressure is high, then it needs to be stabilized. It needs to be reduced so that the patient can be stable. So another thing that happens is that that is the time where medications are given to slow down the progression or to arrest anything that can go on to cause other damages. So at that particular point of medical management, the goal is to ensure that the patient is stable. Now, of course, this management is done by doctors, medical doctors, qualified medical practitioners, using appropriate medication in order to stabilize this patient. Then, during this acute phase, other professionals that can help to manage the condition have been invited. The dietitians, the physiotherapists, and other rehabilitation experts, then the probably clinical psychologists and other people the speech therapists, other people that can also help, because it's usually a multidisciplinary approach to ensure that this patient benefits optimally from all professionals. So during this stage, other professionals can also come in, but there is another phase, which is the rehabilitation phase, whereby the patient undergoes rehabilitation. And of course, the patient can undergo rehabilitation while the patient is still receiving treatment in an acute phase. So the physiotherapist can come in and assess this patient in order to prevent secondary deformities and other complications that can arise. So to ensure that at least this patient does not go on to develop contractures, this patient does not go on to develop stiffness. This patient, if the patient is having pain, the patient is going to be managed so that the pain level can come down. The patient has to be comfortable. All these things is to prevent secondary complications at that acute phase. Then regularly the patient is turned on the bed. A lot of management, something to ensure that this patient does not go on to develop secondary complications or have secondary deformities while on bed. Then this follows the motor restoration phase, where the patient continues rehabilitation to improve the muscle power of the patient and also improve other functions of the patient. Then the treatment continues till the patient is able to thought how to move, how to engage in one thing or the other, then ends with what we call societal or community reintegration. The patient is being taught how to go back to his or her former vocation. It's because stroke rehabilitation does not only end in the hospital, it also ends in the community. What was this patient doing before? And all this while, the patient is also seeing his neurologist, seeing all the medical practitioners who are involved in that patient condition. Patient is still actively, taking his medications, going for medical reviews. If the patient has a need to see clinical psychology, this patient is also seeing all experts who are involved in the patient management. So it is a multidisciplinary approach whereby the patient optimally benefits from all professionals attending to him or her. So for the rehabilitation, the goal is not only to get the patient to start working, the goal is to get the patient to be functionally active as much as possible, whereby the patient is trained how to go and resume his or her role in the community. It's called community reintegration. So in a nutshell, this is all we have to discuss here based on what is stroke, what are the types of stroke, and what is the goal of what is stroke management. Thank you for listening.